Do you have diabetes or high blood pressure? If you have severe and chronic fatigue without any clear reason, you must get your kidney function tested. The first symptom of kidney failure is severe fatigue. Peace be upon you and God's mercy and blessing. Doctor, I often hear about chronic kidney failure, where the patient loses function. What is kidney failure and what are its symptoms? And how can I protect myself from developing kidney failure, especially since I have diabetes and high blood pressure? And the doctor always warns me that, God forbid, at any time, because I have a problem with my kidney function, the situation could progress and I could end up with kidney failure. Simply, what does kidney failure mean? To understand what kidney failure is, we first need to know what the kidney does in the body. The kidney is responsible for regulating fluids in the body and removing toxins. So any water you drink or any fluids, the kidney filters them and removes them basically. It's responsible for cleansing the body of toxins. The most common toxins that the kidney removes are calcium and potassium, which result from the breakdown of the food we eat into toxins that are then expelled through urine. Are the functions of the kidneys? Yes, they are. The kidney is responsible for regulating salts and minerals in the body. Among the most important of these salts are calcium and phosphorus. These salts are responsible for regulating carriers in the body, such as the parathyroid gland. There is another function of the kidneys, which is regulating blood pressure. Sometimes a kidney patient, their blood pressure is high, and this is what can lead to kidney failure if their fluid balance is not regulated. The regulation of the body's blood pressure level. Simply put, these are the functions that the kidneys are responsible for. Therefore, when kidney failure occurs, there are two types: acute kidney failure and chronic kidney failure. We will talk about acute kidney failure later. But simply, in this case, the kidney also experiences a disturbance in its functions. Kidney function levels increase, and sometimes we may resort to temporary dialysis sessions, but the kidney returns to its normal function. This happens when we treat the underlying cause of the kidney failure. But with chronic kidney failure, which is what we're talking about, the kidney has completely lost its ability to filter toxins and fluids. So these fluids and toxins accumulate in the body. So what are the symptoms of chronic kidney failure? The most common symptom, and unfortunately many people don't notice, is severe fatigue and exhaustion. You might feel tired and worn out for no apparent reason, and you keep telling yourself, I'm just exhausted because I work a lot. But in reality, if you have diabetes or high blood pressure, if you have severe and persistent fatigue for no reason, you must get your kidney function tested. The first symptom of kidney failure is severe fatigue. The second symptom is fluid retention in the body. Fluids accumulate in the body because the kidneys can't remove them. Where do they accumulate? They accumulate in the legs, they accumulate under the eyes, they accumulate in the extremities. But the most common place they accumulate is in the legs. You'll notice the patient's legs are swollen, and what happens is that the kidneys can't maintain the level of albumin in the body, so they are forced to let it go. First, as we said, is severe fatigue. Second is fluid retention in the body. This is a very common symptom. Unfortunately, many people don't notice it, which is persistent hiccups, meaning repeated hiccups for no apparent reason. This happens as a result of increased toxins in the body. There are other things as well. Yes, other things such as high blood pressure. As we mentioned, if the kidneys fail, they can cause high blood pressure. Another common symptom of kidney failure is severe itching. This is because when the kidneys go into failure, there is a disturbance in the salts and minerals we mentioned, including phosphorus. When phosphorus levels rise, it causes itching in the body, which is considered one of the most common symptoms of chronic kidney failure. So, who are the people at risk of developing chronic kidney failure? There are many diseases. What are the diseases that can cause chronic kidney failure? The most common diseases that can cause chronic kidney failure are diabetes and hypertension. Some autoimmune diseases can also cause this. There are also some medications which we'll mention at the end of the video that can lead to kidney failure. The most common causes of kidney failure: high blood pressure and diabetes. If you don't control your blood pressure and diabetes, it's very likely that you'll develop kidney failure, and it could progress beyond that. There are also other causes like hereditary factors such as kidney cysts. These kidney cysts can very likely cause kidney failure in family members. So if someone has kidney cysts, we might advise them to do kidney function protein tests for the family. So how do we diagnose chronic kidney failure? Diagnosing chronic kidney failure involves several things. Most importantly, doing an abdominal and back ultrasound to examine the kidney tissue and to check the size of the kidneys. We also do some simple tests like urea and creatinine, which are blood markers, as well as calcium, phosphorus, and potassium. All of these are affected by the kidneys. These tests can show whether the kidney has acute or chronic insufficiency. So how do we treat chronic kidney failure? The only way to treat chronic kidney failure is through hemodialysis or peritoneal dialysis. Alternatively, we can do a transplant. Unfortunately, there are no medications in the world that can restore kidney function to normal once chronic kidney failure has occurred. Don't let anyone fool you by saying there are herbs, powders, or any medications that can restore the kidney to its function. If there is chronic kidney failure, then we must resort to hemodialysis or peritoneal dialysis. Or, even better, we can do a kidney transplant afterwards. How is the hemodialysis procedure performed? It's actually very simple. We need to take a certain amount of blood, filter it through the dialysis machine, and then return it to the patient. How do we do this? First, we need to insert a central catheter, which can be either temporary or permanent, placed in the neck or in the chest. After that, it's preferable to create an arteriovenous fistula in the arm, either here or here, depending on the doctor's decision. This arteriovenous fistula allows us to draw the necessary amount of blood needed for the dialysis process. So, why do we insert a catheter or perform this procedure? We can't just insert a line into any vein here and draw blood. That simply doesn't work, because we need to withdraw a large amount of blood at once to filter it and then return it to the patient. If we draw blood from small vein to another vein, it won't be sufficient. The large veins are located here or here. So we resort to inserting a catheter at first, and then later we create the arteriovenous fistula. So which is better, the catheter or the arteriovenous fistula? To be completely honest, the arteriovenous fistula is better. The catheter is inserted in the neck or chest and is temporary, because it can be a source of infection since it reaches all the way to the heart. Secondly, it bothers the patient. Also, the efficiency of dialysis with it is not very good. But this procedure is actually quite simple. It's done under local anesthesia, not general anesthesia. That means the patient is awake. We connect the artery and the vein together. The whole idea is that the artery is large. The blood flows strongly when we connect it to the vein. That vein becomes enlarged. We wait after performing this procedure for about 1.5 months to 2 months before we start inserting needles into it. So, as we mentioned, one of the advantages of this procedure is that it's easy and simple. After each dialysis session, we insert needles for the patient. Once the dialysis session is over, we remove the needles and the patient goes home without anything left in his arm. Its efficiency in dialysis is better and it's easier for the patient. The risk of infection with it is very low. There are some very important tips. When we perform this arteriovenous fistula procedure, we tell the patient that you must know these things. The first thing is that you shouldn't measure blood pressure from the arm with the procedure. Don't carry anything heavy with the arm that had the procedure, and don't sleep on that arm, because all these things can cause the fistula to stop working. Also, one of the most common reasons the fistula stops working is if you experience low blood pressure. So you need to be very careful about low blood pressure, whether during dialysis or at home. And your doctor will explain this to you by adjusting your medications. So how does the dialysis process work? We will explain the steps for this in an upcoming video, God willing. We will also talk in many future videos about acute or temporary kidney failure, where the patient might need a single dialysis session to stimulate the kidneys, or might receive treatments and the kidneys can start working again. But let's agree that if you have been diagnosed with chronic kidney failure and complete kidney failure has occurred, the only alternative and the only treatment is hemodialysis, peritoneal dialysis, or later on, a kidney transplant. Take care of your health. Your health is important, and don't forget, we made this video for you today with a big goal in mind. I also hope you feel that I did something good today, so always remember to like, share, and help others. And I'll see you next week to check up on you and continue. May God protect you.